Hey guys, I hope you're vibing at home right now. It is currently Sunday, March 22nd, but if you're watching this on Monday, March 23rd, then it's my birthday. I sent you guys an email on Friday. Um, Most importantly in that email is that you're all staying safe, staying healthy. If you need anything, please reach out to me. I just wanted to check in with you and let you know what my life's like right now. In terms of needs, I got everything I need right here. Give you a quick tour of the new classroom slash my wife's office. Um, I got a whiteboard right here. We will be doing some lessons on that every so often. I got my computer all set up. I'll be doing some webcamming from that. You'll see that in just a minute. My wife's got her desk here. And we've got Verna. This is Verna. Hi Verna. Say hi to the students. That's Verna. She's vibing like a cat. What I want to accomplish today in this first lesson is make sure I can connect with you all. Hopefully you're all doing well. I want to make sure you can access the assignments through Schoology. I'm going to try to practice some ways of teaching from home. And then we're going to focus today's lesson around helping you stay informed in the COVID-19 era, which will be a deviation from the curriculum, but it's just for today. I want to make sure that you have some language so that you can stay up to date in the media. Again, and I can't stress this enough, if you need anything, please reach out. That's my cell phone number. I hope y'all are well. Keep vibing. Hey guys, back again. We got Verna still here. Hi Verna. And we're going to go through a quick little slideshow about staying informed in the COVID-19 era. Here's some of the purposes of this. During a crisis, information is everything, and I want to keep you informed. But this is not about trying to scare you. I intentionally stay away from data in this because it's changing daily. I do link the sources in the speaker's notes if you want to read further. And lastly, please remember to stay safe, healthy, optimistic, and adhering to the scientists and healthcare professionals' recommendations. Again, not about trying to scare you, just trying to keep you in the know. All right, so here we go. What are viruses? First of all, oh, I'm going to lose Verna. Okay, bye, Verna. Wait, bye. Bye, Verna. Viruses are microorganisms that replicate inside of a larger organism, like a plant, animal, or human, and can spread between organisms. Viruses can't live for long times or certainly can't reproduce outside of organisms. Humans can develop an immunity or protection to a virus by having their immune systems naturally recover from the virus or from a vaccine, which is a medicine to artificially create immunity. For here we see some different shapes of viruses. Which brings us to the coronaviruses and novel coronavirus. Coronaviruses are a family of viruses that cause respiratory symptoms ranging from the common cold to SARS. They are named so because of their corona-like structure, as you can see here in this picture. And then there's the novel coronavirus. The novel coronavirus is the new, or novel, strain of coronavirus that is spreading across the world. So again, coronaviruses have existed for a while. They cause things like the common cold. You might have had one, but this is a new strain, and that's why we call it novel coronavirus. Where did the novel coronavirus originate from? Coronaviruses are zoonotic, meaning they can jump from animals to humans. Think of the prefix zoo there, makes you think of animals. The novel coronavirus is believed to have made the jump from birds or bats to humans in the city of Wuhan, China. And the novel coronavirus is now a pandemic, meaning it has spread across the globe, whereas an epidemic is an outbreak in only one geographic area. So, what then is COVID-19? Well, novel coronavirus and COVID-19 are often used interchangeably. COVID-19 is technically the infectious disease or set of symptoms that comes from the novel coronavirus and not the virus itself. An infectious disease is an illness that is contagious, meaning it can spread from person to person, unlike other diseases like allergies or cancer, which one person cannot give to another. So again, I would think of coronavirus as the cause. That's the actual microorganism. And then COVID-19 is the set of symptoms that a human would have if they had the novel coronavirus inside them. What does COVID-19 stand for? Here's a breakdown of that acronym. Corona, virus, disease, 2019. So what are the symptoms of COVID-19? Person with COVID-19 will experience fever, cough, shortness of breath. Those are the three big ones. Much less likely is a runny nose or sneezing. So if you have just a runny nose or sneezing, don't instantly jump to the idea that I might have coronavirus. Chances are you probably just have allergies as we're coming into allergy season. Obviously, in very severe cases, pneumonia or fluids in the lungs can develop. Severe acute respiratory syndrome, that's SARS, which I mentioned earlier, can develop, and then of course death. Symptoms could appear between 2 and 14 days of coming into contact with the virus. And then a very important word here is someone may have the virus, be able to spread it to others but not notice, and we refer to that as asymptomatic. You'll hear that word a lot in the news, asymptomatic. How does the novel coronavirus spread? The primary means of spread for novel coronavirus is called person-to-person spread, when droplets from a cough or sneeze enter another person's body. When person-to-person spread happens between members of a single city or town and the exact cause is unknown, we call that community spread. It's different than if somebody contracts the virus while traveling. Coronavirus is also believed to live on surfaces, especially hard surfaces like metal or plastic, for up to 3 days. Then here's a little infographic that just summarizes that. Again, the main symptoms, fever, cough, or difficulty breathing, and the main spread is through person-to-person contact. How do we measure how deadly a virus is? The deadliness of a virus is referred to as the mortality or fatality rate, which is the number of deaths caused by a disease divided by the number of cases of the disease and multiplied by 100 to become a percent. So if 1 in 100 people die from a disease, then we'd say it has a 1% mortality rate. Mortality rate depends on a lot of things. The virus itself, the amount of cases diagnosed through testing, and the treatment that infected people receive. So one thing to note about this right now is as the number of cases go up as testing increases, that actually makes the denominator much bigger and the mortality rate can fall. This is a number that I don't even care to publish about the coronavirus right now because it's changing all the time. That said, we'll look at a couple of graphs to see if the coronavirus is like the seasonal flu and who is actually most vulnerable. So here we compare the coronavirus with the seasonal flu in terms of mortality rate, and you can see that the mortality rate of coronavirus is much higher, and especially in older people. And then here we see that those with pre-existing conditions are also much more susceptible to this disease. So older people and people with pre-existing conditions as of now seem like the most vulnerable. How do we determine how contagious a virus is? The contagiousness of a virus is most commonly expressed with the basic reproduction number, or R0. That's how we read that, is R0, which is the average amount of people one sick person is expected to infect. A virus with an R0 less than 1 will die out quickly. A virus with an R0 over 1 is likely to spread. That makes sense. If somebody has it, then they need to spread it to at least more than one other person to keep the virus living. And we can see here in this graphic, COVID-19, as of now, again, these are changing all the time, seems to have a R0 of about 2.5. Measles, much higher. Influenza is only about 1.5. That's the seasonal flu. Again, R0 is dependent not just on the virus, but also on the response to the virus. If everyone stays at home, the R0 of COVID-19 would fall. Here's a graphic that shows on the x-axis the contagiousness, the R0 value of different diseases, and on the y-axis it's showing the mortality rate. And you can see that we have a lot of diseases, many of these you probably recognize in history, and coronavirus is falling right here in this kind of middle region, which might sound good, but often diseases are either very deadly or very contagious. Seldom do diseases make their way out here into the both deadly and contagious zone, thankfully. A scary thing about coronavirus is that it does have a blend of deadliness and contagiousness. Again, though, these numbers are not settled as the event is still unfolding. That's why it's a range. So what is being done to limit the spread of the novel coronavirus? People should continue to practice good personal hygiene, like covering coughs and sneezes, washing hands frequently, and wiping down surfaces. Social distancing is the practice of minimizing contact with others, staying home as much as possible, and avoiding crowds and not touching other people. And then a quarantine is when a sick or potentially sick person or area is blocked off from the outside world, whereas shelter in place is when everyone is asked to stay home. So those are certainly words that you'll hear a lot as you try to keep up with this event in the news media. Other important vocabulary specific to our healthcare system. Hospitals treat a growing number of patients. Healthcare resources are expected to become scarce or run out. And those resources specifically around the COVID-19 pandemic are ICU beds, which are a measure of how many people can be treated in the intensive care unit, the ICU, of a hospital, where the sickest individuals receive the most care. Two others that are often mixed up. Respirators are devices that keep healthcare professionals safe when breathing by filtering virus particles out of the air. And then even more importantly, ventilators are devices that help very ill patients breathe. Lastly, and probably most tragic about all of this, is when hospitals receive a higher volume of patients than they are able to serve, the doctors do what is called triage, which is prioritizing care to patients who are most likely to recover. By prioritizing care, that means you're choosing those that you can treat now in the moment and refusing care to others. And with that, you are going to do a reading related to a very popular phrase these days in the COVID-19 era, which is called flattening the curve. And that reading will be linked in your assignment and in the week 1 learning module. Thanks for tuning in, guys. I will have more for you tomorrow. Take care.